Assalamu alaikum viewers, hope you are doing well. It's me Maruk Sajad. So today my topic is HIV. Basically we have to find that what is HIV. HIV is human immunovirus and it causes the biggest and the international disease which is known as the AIDS, acquired immunodeficiency syndrome. So we start its information or its discussion from history. So basically, what is the history of HIV? Study explained that HIV first originally comes from a virus from chimpanzee in the West Africa in 1930s and then transmit to the humans through blood transfusion during haunting. Then we have the first case of AIDS, acquired immunodeficiency syndrome, the disease that caused by the HIV human immunovirus. The first case of HIV, it was basically diagnosed in 1982 in the Canada. Then we have that what is HIV? HIV is a virus that attacks the cells that help the body fight against infection. Those antibodies who made our immune system, HIV remove them from our body. And there is no cure but is treated with medicines only. Then we have how HIV affect our body. First of all, HIV virus enters in the immune cells, our immune cells named as CD4 cells, then get integrated into the cell nucleus, then they enter into the cell nucleus and start making their copies. Replication, start making their copies inside the cell, ultimately destroys the human cells, and then it caused immune deficiency and multiple infections that our immunity become at the lowest percent. Then we have epidemiology. It is basically the distribution that male and females both have equal chances to acquire this disease. It There is nothing any other groups, all ethical groups, all ethnic groups, and second leading cause of death all over the world. AIDS cause second leading cause of death all over the world. Then what we have is how does HIV become AIDS? How HIV becomes AIDS? When HIV start replication in our CD4 cells, it causes AIDS. AIDS is the most dangerous stage of HIV, acquired immune deficiency syndrome. So AIDS basically acquired immune deficiency syndrome. A stands for acquired, not inherited. It's not comes from our forefathers. It comes with our physical touch. Then I, weakness of the immune system. It weakens our immune system at its lowest. Then D, create the deficiency of CD4. CD4 cells are basically our immune system cells. Syndrome or a group of illness taking place at the same time. Then what we have? Symptoms of AIDS. Symptoms of AIDS include fever, headache, muscle aches and joint pain, rash, sore throat and painful mouth sores, swollen lymph glands, diarrhea and the weight loss because it causes weakness. Then we have stages of infection. Before this we studied that the causes of HIV or AIDS. The causes of HIV includes HIV virus by having sex. If we are doing sex with our partner who have HIV cells or who have AIDS, then it may cause or lead to cancer or death. By sharing needles and syringes, illicit injections and drug use, from blood diffusion from one person to another during pregnancy or delivery, or through breastfeeding. If the mother is facing AIDS, then the children have chances then that he or she may have AIDS. Then we have stages of AIDS, HIV. So basically we have first one is acute HIV infection, chronic HIV infection, and the third one, the most dangerous one, acquired immunodeficiency syndrome. So basically, stage 1, acute HIV infection. Acute HIV contains large amount of HIV in blood, and in return it causes flu-like symptoms, and some didn't feel even any single symptom. And the flu-like symptom because this is the body's natural response to infection which caused by our antigens, and its symptoms are basically cough, headache, fever, or simply the muscle pain. Then, secondly, we have the chronic HIV infection. This stage is also known as the asymptomatic HIV infection or clinical latency. In this stage, HIV is active but reproduce in a very low level. Who take medicine never proceed to the third stage. If someone is taking the proper medication, then it may no cause the more danger. Then and its symptoms are fatigue, breathing problems, and skin rashes. Then here we have the third stage of AIDS. The most severe phase of HIV infection is AIDS. Okay, the AIDS acquired immunodeficiency syndrome in which our immunity system reduced to its level of 0. Symptoms are high fever, high night sweating, pneumonia, and the memory loss, which are the basic causes of our physical fatigue. Then we have risk factors. Risk factors like sexual practices that promote diseases. If you are doing sex with multiple partners, then it may spread from one another. Exposure or blood or bloody fluids. When we visit any hospital, we may use syringes or any other things which are not contaminated, which also cause or spread HIV AIDS. Then you are seeing that the blue color is representing that male to male sexual contact which cause 61% of HIV AIDS. Then injection drug use, it's represented, it's green color, 8% only. Male to male sexual contact and injection drug use, 3%. Heterosexual contact, 28%, and others only 1%. Then we have preventions. Avoid multiple partners, use condoms, use sterilized needles each time for infection that they must are contaminated. Never share needles, avoid unnecessary blood transfusion, never buy blood from professional donors, do not donate blood, and all pregnant women should be tested for HIV before their pregnancy or breastfeeding maybe. Then limit your numbers of sexual partners, get vaccinated, do not abuse alcohol or drugs, use new and sterilized needles or syringes each time. Only use needles and syringes that you got from a reliable source. Throw away syringes and needles after one use. Don't share needles or syringes with friends or family. They may cause or spread the AIDS. Okay, now we have outcome managements, that treatments. Basically there is no proper treatment, but we can are overcome with it, like maintaining our health, taking good food, energy, prevent infections, like we have to avoid sexual activity and other things like contaminated syringes and blood transfusion, etc. Okay, now we have to maintain our health, like annual screening, for we have to visit a doctor for once in a 6 months. TB skin test which may lead to AIDS, chest x-rays, and pregnancy for sure. Thank you so much guys, hope you can understand my lecture. Thank you.